There are 500 children who die every single day as a result of road traffic injury. Now, many of these children are making the journey from their home to their school.
It's really just, a call of action that the kids have asked for us to try and help them, get to school safely. We all know that the kids deserve protection on the roads, and we've heard them, and we're here to say, we've heard you, and we're here to ensure that you get to school safely and get back home.
So our new global initiative for child health and mobility is really the first time ever that we've had a global effort bringing together some really serious partners to make the needs of children, the particular rights and requirements of children in terms of how they move around towns and cities, the absolute focus of policy, and taking that policy from the abstract into practical delivery in every city and on every street.
I'm absolutely delighted that the Overseas Development Institute is going to be part of this initiative, because what we're dealing with here is one of the great development challenges of our day, the challenge of how do we prevent and drive down the 1.2 million deaths that happen every year on the world's roads. How do we prevent and reduce the public health threats that are posed by air pollution from vehicles? How do we reduce the carbon dioxide emissions that are driving us towards an unsustainable future for the whole planet? So I'm absolutely delighted that we'll be part of this broader coalition with the World Resources Institute, with UNICEF, with Save the Children and others. And I genuinely believe that by pooling our resources and coming together, this is a problem that we can solve.
And we can support this effort by building a powerful argument and a broad coalition and campaign focusing attention on the rights of the children.
We're entering this partnership with the FIA Foundation because when you look at who is dying of accidents, transit accidents, within a city, you will see great disparities. That is, children who live in the more marginalized areas are more prone to die of transit accidents than children who live in wealthier areas.
So with this global initiative, we're putting together a very practical initiative, a very practical partnership, which plays on the strengths of the various organisations which are working together. So we're working with child advocacy organisations, development research organisations, experts in city management and street design, and we're trying to establish the arguments and do very practical interventions to improve legislation, to improve access to cycleways and sidewalks, to ensure there are safe crossing points, to look at the whole concept of a safe and healthy journey to school as being the thing that we want every child to have by 2030.
From a health perspective, we know that pollution, indoor and outdoor pollution, every year kills more than 7 million people prematurely. So from a climate change perspective, the more we can reduce the consumption of fuel per mile or per kilometer, the less emissions we will also have into the atmosphere. And clearly, the world's fleet of vehicles is a very significant factor in terms of carbon dioxide emissions and other greenhouse gases.
The important thing now is that we are beginning to have countries which are taking on leadership and working with organizations in the UN and FI Foundation. What is so amazing about road traffic injuries is that we have the strategies there. The important thing is how to share the good practice. The important thing is to really encourage the commitment, political commitment, to carry out the action. So that is why we are really delighted with this partnership with the FIA Foundation, because it's helping us to do concrete work in the countries and really support what countries want help with.
You need actually action from government, you need action from lots of different players, lots of principals, lots of agents. And so, for example, it's terribly important that we have organizations like the FIA Foundation, for example, and we are seeking to create momentum in the various coalitions that are going on, and nothing is more important than transportation and urban development, and bringing those two together could be truly transformative.
The targets on cutting road deaths in 5 years are very, very high indeed, but they're absolutely necessary. You know, we're talking about thousands and thousands, hundreds of thousands of human lives and families who are affected by it. So they are a message to governments that you've signed up to targets, you've got to achieve these targets, and in achieving these targets you're saving hundreds of thousands of people's lives. So it has to get into the minds of governments, institutions, organizations that they're committed and they better deliver.
So the reason Save the Children has joined the global initiative for child health and mobility is you can't get access to health without being able to safely move about. That mobility piece is critical. You can't get your education if you can't move around safely. So just think about everything you have to do if you're risking your life to get to your health center, to get to a school. Two things where Save the Children believes is a critical right of children and their families to have good health and good education. You can't have them if you don't have good, safe roads.
Bringing an initiative that is focusing on children has the enormous potential of really changing things. And together with a very high-level group, we are all going to be able to work together to bring to the table the best practices and the best recommendations to really protect the children. And when we protect the children, we're going to be able to protect everyone.
We often talk about child rights as though they're a very abstract legal type of issue. They're not an abstract legal question. They're about the safety and security of some of the world's most vulnerable people. Agreeing the Sustainable Development Goals was very tough. It took around 2 to 3 years to negotiate the final text. But in the end, you have to judge these declarations of intent not by the words that are on the paper, but on the practical delivery and the difference that they make in the lives of very vulnerable people. What the Global Initiative for Child Health and Mobility is trying to do is to take those promises, to take those targets and the commitments that are now enshrined in the Sustainable Development Goals, and to turn them into a practical agenda that will deliver the real policy changes that will make a difference in people's lives. So this is about going from promise to practical action.
We know if you save the life of a child, that this makes a difference for the next 60, 70, or 80 years. It's worth saving the life of a 70-year-old, but it doesn't have the same impact as saving the life of a child. And to be able to get a child to school safely can be done. We know it can be done, and it's done in many places, but it requires actual decisions that is to be done. Once you reach a certain level, you won't go back. It's not like flu that you take care of one outbreak and then it comes back the next year. With this, if you get people to a certain point, it means the roadways have changed, the cars have changed, the rules have changed, and you will not go back. So it's like eradication in a sense, that one continues to improve, it doesn't go back. It can be done, and it obviously should be done.
We want to see governments taking a philosophical approach that transport and urban planning should have at their core child health and the rights of the child. And we would lay out this challenge to policymakers. Which child do you think can be sacrificed? When you're looking at your budget decisions, when you're looking at your planning decisions, you tell us which child you're going to leave behind and you're going to allow to be injured or have health problems which are going to affect them for the rest of their lives. It's a very difficult question to answer if you're looking one-to-one at the child. Viewed in abstract, maybe it's a little bit easier. What we're trying to do with this global initiative is close down that distance. We want to get policymakers one-to-one with children and make them explain their decisions.